Therapy is treatment methods and techniques used to make people feel better and function more effectively. When discussing the treatment of psychological therapies, two main types are widely used. The first kind of therapy is called psychotherapy. Psychotherapy, used amongst people with and without mental disorders, is a form of talk therapy. The goal is to assist individuals in understanding themselves, their motives, and their actions. So, Mr. Wellard, how does the death of your dog make you feel?
I've just been really depressed ever since it happened.
The second kind of therapy is called biomedical therapy. This form of therapy relies on drugs, electric shock treatment, and surgical methods to aid an individual with a mental disorder. Mr. Wellard, to help cope with your depression, I'm prescribing you these antidepressants. There are multiple approaches to psychotherapy, such as humanistic therapy, cognitive therapy, psychodynamic therapy, behavioral therapy, and dialectical behavior therapy. I will be going more in depth with the techniques and methods of behavioral therapy and psychoanalysis, so here are brief definitions of the others. Humanistic therapy focuses on the conscious rather than the subconscious, emotion, and more recent experiences in daily life, rather than distant past experiences from childhood. Emphasis is placed on self-responsibility and creating self-help techniques. Cognitive therapy focuses on changing the way in which individuals think. Rather than making focus on behavior the number one priority, clients are encouraged to ditch their defective cognitions about themselves and the world around them, and instead adopt new solutions to old problems. This type of therapy is very structured and only lasts a maximum of 20 sessions. Dialectical behavior therapy puts emphasis on teaching people to become accepting of who they are, whether or not it matches their ideal self. This form of therapy incorporates cognitive behavioral therapy, mindfulness techniques, and Zen Buddhist techniques. Clients are taught to focus on who they want to be in the present moment and letting the past stay in the past. Psychodynamic therapy is the general term for therapies that are based on psychoanalysis. Psychoanalysis is a method created by Sigmund Freud designed to help patients explore their innermost thoughts and feelings without fear of judgment or rejection. Psychoanalysis puts an emphasis on transference, shorter treatment sessions, and direct therapeutic approaches. Patients are guided through their unconscious, typically starting with their earliest childhood memories and working their way into more recent memories in present life, like relationships with their parents or other important individuals. In psychoanalysis, transference is when the patient projects their positive or negative feelings from people from their pasts onto their therapist. It is then the therapist's job to assist them in recreating these past experiences so they can reprocess them in a safe place. The goal is for the patient to relive, then resolve the experience. In this exaggerated example, let's say a client's therapist has the same pink afro as their father does. This similarity may make it easier for the client to relive past experiences with their father and project them onto their therapist. Two techniques that Freud used in psychoanalysis were called dream interpretation and free association. Freud believed that repressed content often surfaced in dreams, but materialized in symbolic forms. During dream interpretation, the patient will explain a vivid or important dream they had, and it is the therapist's job to search for the latent content in the unconscious mind.
Went back to my old high school, but I was fully clothed, and then the moment I walked into my classroom, I was just completely naked, and everyone was laughing at me.
Free association is a technique used for revealing the unconscious mind by encouraging patients to freely express themselves and say what's on their minds without fear of judgment or negative evaluation.
Well, it's been really kind of killing my mood? That Trader Joe's, they have this type of cereal I love, and they haven't been keeping it in stock.
This approach focuses on learning's role in developing normal and abnormal behaviors. Methods such as reinforcement, extinction, classical and operant conditioning are used in behavioral therapy. Some examples of classical conditioning include systematic desensitization, aversive conditioning, and exposure therapies. In systematic desensitization, the patient is exposed gradually to stimuli which trigger anxiety and are taught relaxation and breathing techniques to overcome the response of their anxiety. The patient will then create a hierarchy of fears, starting with the situation that causes the least degree of fear, working their way up to the situation that causes the greatest degree of fear. For example, this young man appears to have a phobia of fountains due to a traumatic experience he had with one when he was a child. Going at his own pace and remembering his breathing and relaxation techniques, the young man slowly approaches the fountain. Still utilizing his breathing and relaxation techniques, he is able to find the courage to sit on the edge of the fountain. Though he's still hesitant, this is the closest and most successful he's ever been at overcoming his fear of water fountains. Aversive conditioning is a form of therapy where the use of something unpleasant or a punishment is utilized to stop undesirable behavior. For example, in this cartoon you can see a man getting an electric shock administered to him every time he smokes a cigarette. Pairing this aversive stimulus with the stimulus that results in the undesirable response will turn the patient off of smoking. Next up in classical conditioning is exposure therapies. There are two types of exposure therapies. One is graded exposure, which is very similar to systematic desensitization. The patient is gradually exposed to the anxiety-provoking stimuli using relaxation and breathing techniques. The second type of exposure therapy is called flooding. This technique floods the individual with sudden confrontation to the feared stimuli. Unlike graded exposure, no relaxation or breathing techniques are used. Therapists hope that by exposing the individual to the phobic object in a secure environment for a prolonged amount of time, that the sufferer will begin to associate positive feelings with the phobic object, such as a safe environment and a lack of fear. Now that we've talked about classical conditioning and behavioral therapy, let's talk about operant conditioning. Operant conditioning uses techniques such as token systems, contingency contracting, and observational learning to alter or change the frequency of behavior. In a token system, objects, or the tokens, are earned for accomplishing behavioral goals or good behavior. These tokens can also be taken away if the patient exhibits poor behavior. These tokens can be traded in for things like candy, treats, toys, or special privileges. This method has been used successfully amongst a wide demographic, ranging from young children to adults who suffer from various mental illnesses.
Okay, Sam, for each time you say please and thank you, you'll get one of these tokens. When you get 5 tokens, you can have a cookie.
Can I play outside, please?
Yes, here you go, good boy.
Thank you.
Clean your room.
Okay,
Thank you.
thank you. I got these 5 tokens. May I please have a cookie now?
Yes, good job.
Yay!
A contingency contract is a formal agreement made between the therapist and the client, stating the responsibilities and goals of both parties. Penalties and positive reinforcements are both enforced and consistent, making the client aware of the consequences he or she will suffer if they break the rules of the contract. Contingency contracting is a method used on people of all ages. The last method used in operant conditioning is called observational learning. Modeling, or learning through the imitation or observation of a model, is another technique used in observational learning. In participant modeling, models demonstrate a step-by-step guide of desired behavior to the client. The therapist will push the client to then imitate this step-by-step process. For example, at recess time, all the children gather around the slide. Everyone is having fun except for one boy who is afraid of going down the slide. After observing his peers model the desired behavior, his anxiety starts to reduce. Thanks to observational learning, he takes a deep breath, climbs up the stairs, and makes his way down the slide successfully.